On-site first aid for traffic accidents. Hello, everyone. The hazards of car accidents have a strong chain effect. Not only can vehicles be destroyed and lives lost, but nearby individuals and innocent bystanders may also be affected. In this lesson, we will explore the assessment of injuries caused by traffic accidents, on-site first aid, and preventive measures. The assessment of injuries from traffic accidents are mainly conducted from two aspects. 1. Assessment of the overall condition. 1. Consciousness disorders indicates possible brain injury or shock, signifying critical condition. 2. Irregular or difficult breathing or respiratory arrest indicates possible brain injury, high cervical spine injury, chest trauma, or airway obstruction. 3. Weak or absent pulse indicates significant blood loss, severe injury, and shock. 4. Unequal or dilated pupils indicates severe brain injury. 2. Assessment of important organ injuries. 1. Brain injuries may present with head bleeding or hematoma, altered consciousness, and pupil changes. 2. Chest injuries may present with wounds or abrasions on the chest deformity, and difficulty breathing. 3. Abdominal injuries may present with abdominal pain, tenderness, percussion pain in the liver and spleen areas, and shock. 4. Spinal fractures may present with spinal deformity. Cervical spine injuries can cause quadriplegia, while thoracic and lumbar spine injuries can cause paralysis of the lower limbs. 5. Limb fractures may present with limb swelling, deformity, and limited movement. Let's continue our discussion on how to conduct on-site first aid after a traffic accident. First, assess the on-site environment and ensure self-protection. Rescue operations for traffic accidents begin with an assessment of the on-site environment to ensure the safety of both the injured and the rescuers. Dangerous factors following a traffic accident include vehicles, hazardous materials, fire, dust, and bodily fluids of the injured. Rescuers should set up warning signs, use lights and reflective vests, etc., to prevent further injuries from passing vehicles. Additionally, be aware of potential dangers such as vehicle fires, explosions, falling rocks, and collapses. Standard protective measures should be undertaken by rescuers. 2. Accurately assess injuries. Examine the overall condition and important organ injuries of the injured. Understanding the mechanism of injury helps better assess the injured and determine the type of medical assistance needed. Follow the principle of life-saving first, injury treatment second at the accident site. Prioritize rescuing from danger, resuscitating life before symptomatic treatment, treating severe injuries before minor ones, and performing rescue before transport. Identify critically injured individuals and perform emergency treatment and transfer according to triage priority levels. 3. Emergency treatment. 1. Maintain respiratory and circulatory function. To keep the airway open, quickly remove any foreign objects, secretions, or vomit from the mouth and nose. For patients with jaw fractures but no cervical spine injury, the neck can be supported and the head tilted back to open the airway. For patients with brain injuries who are in deep coma and have tongue fallback, the tongue should be pulled out and fixed, or an oropharyngeal airway can be placed. For those with cardiac or respiratory arrest, perform cardiopulmonary resuscitation, CPR. If conditions permit, provide oxygen inhalation and establish an intravenous line promptly. 2. Hemostasis and bandaging. If there is bleeding, apply sterile gauze to directly press and stop the bleeding. If necessary, use a tourniquet to tie off the bleeding. The tourniquet should be marked with the time, and it should be loosened periodically to prevent ischemic necrosis of the limb. 3. Fracture immobilization. In on-site rescue, Fracture immobilization is temporary and generally involves using splints. Items found on site, such as wooden boards, bamboo poles, or branches, can also be used as substitutes. 4. Reduce contamination. For open brain injuries or open abdominal injuries with brain tissue or abdominal organs protruding, do not push contaminated tissues back inside. Cover the protruding tissue with a sterile bowl or a similar clean container, then bandage it. 5. Special situations. 1. If a wooden stake or other object is impaled in the body cavity or limb, do not remove it immediately. Wait until reaching the hospital and preparing for surgery before removing it. Sometimes the object may be plugging a blood vessel. Removing it prematurely could cause massive bleeding that may not be manageable on site. 2. If there is a localized floating chest wall, flail chest, caused by multiple rib fractures leading to paradoxical breathing, use wide adhesive tape to stabilize the chest wall. 3. For open chest injuries, place the patient in a semi-sitting position and apply a sealed bandage to the chest wound to convert an open pneumothorax into a closed pneumothorax and transport the patient to the hospital quickly. If rescuers can identify a tension pneumothorax and conditions permit, they may perform needle decompression or place a chest drainage tube. 4. If limbs, ears, or nasal tips are amputated, after wrapping the stump with sterile gauze, also wrap the severed parts, finger, nose, or ear, with sterile dressings and send them to the hospital together for possible reattachment. 6. Transport and transfer. For patients with spinal injuries, movements must be stable to prevent spinal bending. Use a rigid stretcher for transporting those with spinal fractures. For cervical spine injuries, use a neck brace to stabilize the head during transport. If no neck brace is available, use soft pillows or sandbags on both sides of the neck to prevent head movement. 4. Coordination among on-site rescuers. At the scene of a traffic accident, it is crucial that participating rescuers, including police, firefighters, medical personnel, and others, clearly understand their responsibilities, perform their respective duties, and coordinate with each other. Responsibilities of police at the scene. Direct traffic and control any chaos or congestion at or around the scene. Establish a security perimeter and preserve the scene for investigation. Disperse or control individuals who interfere with rescue efforts and direct vehicles that may obstruct rescue routes to leave the scene. Responsibilities of firefighters at the scene. Extinguish any vehicle fires and control the leakage of toxic substances. Rescue injured individuals from smoke-filled areas. Stabilize tilted vehicles using airbags or wooden supports. Protect other personnel and the injured from electrocution by securing hanging electrical wires. Extricate injured individuals using hydraulic cutting and spreading tools to free them from damaged vehicles. Clear and remove any hazardous items that may cause further injury. Provide lighting and power supply for on-site rescue operations. Responsibilities of medical personnel at the scene. Quickly provide medical aid to the injured. When there are many injured individuals and insufficient medical personnel, some firefighters and rescuers should assist with emergency care and transportation of the injured. If the accident scene is contaminated with toxic substances, specially trained decontamination personnel must handle on-site disinfection and cleaning. All personnel entering the scene must wear specialized protective clothing. Injured individuals must also undergo on-site decontamination. Most traffic accidents can be prevented. Enhancing safety education and management of motor vehicle operation can significantly reduce the occurrence of traffic accidents. Key preventive measures include: A. Conduct safety education to improve driver quality and establish strict laws and regulations to prohibit drunk driving and fatigue driving. B. Pedestrians and cyclists should also follow traffic rules, such as not running red lights or jaywalking. C. Improve vehicle design and manufacturing processes to enhance safety performance. D. Improve roads and environments to increase safety levels. Alright, the content above covers the assessment of injuries from traffic accidents, on-site first aid measures, and preventive measures. Please adhere to traffic regulations in your daily life and take primary responsibility for your own safety.